Today, we will talk about fatty liver disease and the vitamins that can reverse it. We will also briefly touch on what it is, how it happens, how it's treated, and more importantly, what you can do about it, including how you can keep it from happening to you if you don't already have it. Welcome to our video on the 5 vitamins that can reverse fatty liver disease. Let's get right into it and start our countdown with number 5, BComplex Vitamins. In 2022, scientists at Duke Medical School in Singapore found that vitamin B12 and folic acid could be used to prevent or delay the progression of non-alcoholic fatty liver disease, or NAFLD. While the B-complex family contains 8 vitamins, 3 have shown particular promise in treating the condition. These include B3 or niacin, B9 folate, and B12 cyanocobalamin. Scientists also discovered that these vitamins play a crucial role in reducing liver inflammation and scarring. They have also been shown to prevent further fat accumulation and restore normal cellular cleanup processes that may have been impaired. The discovery that B-complex vitamins can be used to treat fatty liver disease represents a significant advancement in liver disease treatment, offering a relatively simple yet powerful intervention for a condition that has been traditionally challenging to treat. This vitamin-based approach also could provide a safer, more accessible alternative to conventional treatments, particularly for patients with limited therapeutic options. Next up, vitamin E. A potent antioxidant, vitamin E has demonstrated considerable potential in treating non-alcoholic fatty liver disease. Clinical trials have shown that supplementing with vitamin E can decrease the NAFLD activity score, which is a measure of disease severity. However, it's important to note that vitamin E, unlike B-complex vitamins, doesn't directly address fibrosis, the scarring that can occur in the liver. The American Association for the Study of Liver Diseases recommends vitamin E supplementation at 800 IU per day, specifically for non-diabetic and non-cirrhotic adults with NAFLD. This dosage is considered safe, and research shows that taking 540 milligrams or 800 IU or less per day is unlikely to cause any harm. The recommended treatment period is from 24 weeks to 96 weeks. For the best results, vitamin E supplementation should be taken with food containing fat, as vitamin E is fat-soluble, combined with lifestyle modification including dietary changes and regular exercise. And it should be monitored by a healthcare provider, especially for those with bleeding disorders or heart conditions. The upper tolerable intake level is set at 100 milligrams, approximately 1,500 IU per day for adults. However, long-term use of high doses should be monitored, as some studies suggest potential risks with prolonged high-dose supplementation. Let's take a quick break from the list and answer a few questions. First, what is fatty liver disease? Fatty liver disease is a complex medical condition characterized by the excessive accumulation of fat in liver cells. This can lead to serious liver damage and complications. There are 2 main types. The first is metabolic dysfunction-associated steatotic liver disease, or MASLD, also known as non-alcoholic fatty liver disease, or NAFLD. And the second one is alcoholic fatty liver disease, which stems from excessive alcohol consumption. So, how does fatty liver disease develop? This can happen in a number of ways. Fat can migrate from other parts of the body to the liver. The liver may increase its absorption of fat from the intestine, or it may lose its ability to process and eliminate fat effectively. Certain risk factors for the condition include obesity, particularly if you have excess weight around the waist, type 2 diabetes, elevated triglycerides, and high cholesterol levels. It can also come about from rapid weight loss, certain medications, sleep apnea, polycystic ovary syndrome, and thyroid dysfunction. This can also happen if you have metabolic syndrome, which is a term that lumps together a group of health problems like obesity, hypertension, and diabetes. There is a lot more to discuss about fatty liver disease. For a deeper look at the condition, check out our video on everything you need to know about fatty liver disease, linked on the upper right-hand side of your screens now. Jumping back in with number 3, the only non-vitamin on this list. Number 3, omega-3 fatty acids. It may seem counterintuitive that adding fatty acids could help when you already have a fatty liver. Yet, research shows that omega-3s play a crucial protective role. This apparent paradox is explained by omega-3's unique ability to improve how the liver processes and metabolizes fat. Omega-3 fatty acids have been shown to help with fat processing. They enhance the liver's ability to break down existing fat deposits and prevent new fat accumulation. Inflammation control. These fatty acids possess potent anti-inflammatory properties that help reduce liver inflammation, and it also has metabolic benefits. Omega-3s improve insulin sensitivity and help regulate blood sugar levels, which are often disrupted in fatty liver disease. A 2023 study following over 411,000 people for 11 years found that omega-3 supplements significantly reduce the risk of liver disease by 28.4%. The benefits were even more impressive for specific conditions, with a 44.1% reduction in alcoholic liver disease and a 45.2% decrease in liver failure risk. Regarding dosages, it is estimated that men need about 1.6 grams per day, while women need 1.1 grams per day. Most supplements provide between 450 milligrams to 1300 milligrams of combined EPA and DHA. Take your omega-3 supplements with meals that contain some fat, as this helps your body absorb it better. You can split the dose between morning and evening meals to avoid any stomach discomfort. You should take omega-3 supplements for at least 6 months to see benefits. Studies have shown that taking them for 24 to 96 weeks, or about 6 months to 2 years, can help improve liver health. Before taking any omega-3 supplementation, it's important to talk to your doctor first and keep these points in mind. Don't take more than 3 to 4 grams total per day. Tell your doctor if you're on blood thinners. Choose a supplement that contains both EPA and DHA, and look for supplements that have been tested for quality and purity. Remember that while these are general guidelines, your doctor might recommend different amounts based on your specific health conditions. Are you finding this video helpful? If so, please do us a favor. Hit the like button and consider subscribing to our channel. We are down to our last 2 vitamins. Next up is vitamin D. Recent research has highlighted the critical role of vitamin D in non-alcoholic fatty liver disease. Studies have shown that vitamin D deficiency is strongly associated with both the progression and severity of the condition, with about 70% of NAFLD patients showing insufficient vitamin D levels. Vitamin D helps reduce liver inflammation, decrease oxidative stress with liver tissue, enhances immune system function, and supports overall liver health. The vitamin also shows promise in reducing hepatic fibrosis by inhibiting the activation of hepatic stellate cells, which are responsible for liver scarring. For optimal management of NAFLD, vitamin D levels should be maintained above 30 ng/ml or 30 nanograms per milliliter. The standard recommended daily dosage ranged from 800 to 2000 IU for most adults. However, individuals with specific risk factors such as malnutrition, obesity, or limited sun exposure may require higher doses. But of course, this has to be done under medical supervision. So, talk to your doctor before upping your vitamin D intake. We are fans of vitamin D on this channel and talk a lot about it. If you want to learn more about its many benefits, check out the playlist linked in the description box, as well as at the end of this video. Any guesses on what the number one vitamin to help with fatty liver disease is? Number 1, vitamin C. Vitamin C acts as a powerful antioxidant in the liver, offering multiple protective effects. Studies show it helps reduce inflammation, decrease oxidative stress, and improve overall liver function. The vitamin's ability to scavenge free radicals makes it particularly effective in protecting liver cells from damage. A landmark 2021 study demonstrated significant benefits of vitamin C supplementation for liver health. When patients receive 1,000 milligrams of vitamin C daily for 12 weeks, they showed marked improvement in liver health markers and glucose metabolism. The supplementation was particularly effective for patients with NAFLD. This is because vitamin C has been shown to reduce inflammation by inhibiting inflammatory responses, decrease markers of liver damage, improves protein synthesis, and it also enhances the liver's natural detoxification processes. As for dosages, the most promising results have been seen with a daily dose of 1,000 milligrams, though benefits can be observed at lower doses. Again, if you have any underlying conditions, talk to your doctor before taking vitamin C in high doses. So, what can you do about fatty liver disease and how can you keep it from happening to you? The best way to prevent fatty liver disease include maintaining a healthy weight, limiting or avoiding alcohol consumption, having a healthy diet, exercise, and managing related conditions like diabetes, hypertension, and high cholesterol levels. These tips will also apply if you already have fatty liver disease and are looking for a way to manage it. Fatty liver disease can often be reversed with proper lifestyle changes if caught early enough. Work closely with your healthcare providers in order to develop a treatment plan to manage the condition effectively. We'd love to hear from you. Do you have a go-to vitamin for fatty liver disease that we did not discuss in this video? Let us know in the comments section below. And be sure to check out our playlist for vitamin D and fatty liver. We recommend watching this video on everything you need to know about vitamin D on your screens now. Your Wellness Journal is run by a team of nurses, and we aim to provide you with easy-to-digest information from the perspective of medical professionals who have been trained to always put you first. We are your Wellness Journal. Have a healthy day.